Hi, Kylie.
Yes, ma'am.
Hey, my name's Renee. I'm going to be your nurse practitioner today. How are you doing today?
I'm doing good.
Okay. What brings you in the office today?
So my right ear is hurting. It started about 2 days ago. I went swimming in the lake.
Oh, okay.
And
Okay.
so I figured that's maybe why it's hurting. So
Okay. Okay. Yeah. Have you ever had earaches before?
no, ma'am.
Okay. This is the first time?
Yes, ma'am.
Okay. All right. Can you describe the pain for me? Kind of what it feels like?
It's like just an aching pain.
Okay. And when did it start?
It started 2 days ago.
About 2 days ago?
Yes,
Okay.
ma'am.
Are you hurting anywhere else? Sore throat, headache, anything like that?
No, ma'am.
Okay. All right. Is it constant pain or does it come and go?
It comes in waves.
Comes in waves. Okay. On a scale of 0 to 10, with 0 being no pain and 10 being severe pain, how would you rate it?
About an 8.
Okay. Okay. So pretty uncomfortable. Okay. Have you taken any medicine for it?
No, ma'am.
Okay. Nothing over the counter.
No, ma'am.
Tylenol, Motrin. Okay. No kind of ear drops or anything. Okay. Is there anything that you found that makes it better or makes it worse?
No, ma'am.
Okay. Okay. Any other symptoms? Nausea, vomiting, diarrhea,
No, ma'am.
anything like that? Okay. Has anyone else in the house been sick?
No, ma'am.
Okay. Do you live with your, who do you live with?
I live with my parents.
Okay. Okay. Mom and dad and stepmom?
Mm-hmm.
Okay. Okay. All right. And nobody's been sick?
No, ma'am.
Okay. All right. Do you have any other medical problems?
No, ma'am.
Okay. No problems with your blood sugar, any muscle issues, anything like that?
No, ma'am.
Okay. Do you exercise?
Yes, ma'am.
Okay. How often do you exercise a week?
Like 3 to 4 days a week.
Okay. And how long do you exercise?
About an hour.
Okay. Okay, good. What about your diet? Do you feel like you eat pretty good or?
It's like balanced. A pretty much
Okay.
balanced diet.
Okay, so you try to eat pretty healthy?
Yes, ma'am.
Okay, good. Okay. Any family history of medical problems, high blood pressure, diabetes, cancer, anything like that?
Not that I know of.
Okay. And are you up to date on all your vaccinations? Your
Yes, ma'am.
childhood vaccinations? Okay. All right. Are you allergic to any medicines?
No, ma'am.
Okay. Any environmental allergies?
No, ma'am.
Okay. Allergic to latex or
No.
any kind of? Okay. All right. Do you smoke at all?
No, ma'am.
Use any kind of tobacco products?
No, ma'am.
Okay. Vape?
No, ma'am.
Okay. Do you drink any alcohol?
No, ma'am.
Okay. Any drugs, street drugs of any kind, weed?
No, ma'am.
All that. Okay. Do you have a partner or are you sexually active?
No, ma'am.
Okay. And when was your last period?
About 2 weeks ago.
Okay. All right. And do you have pretty regular periods, monthly periods? Do you ever skip a month or?
No, ma'am. It's pretty regular.
Pretty regular. Okay. Okay, good. And when was your last period?
About 2 weeks ago.
Oh, I'm sorry. Okay. All
No,
right.
you're good.
Okay. Any major stressors in your life right now?
No, ma'am.
Okay. You feel like you ever have any problems like with anxiety or depression?
No, ma'am.
Okay. Anybody in your family have problems with anxiety or depression?
No, ma'am.
Okay. What religion are you?
I'm Christian.
Okay. Okay. Do you go to church on a regular basis?
Yes, ma'am.
Okay. Okay. Pretty active in your faith.
Yes,
Okay.
ma'am.
Okay. Any other symptoms today? Anything else going on?
No, ma'am.
Okay. Okay. All right. Well, good. We're gonna next thing we're gonna do is a physical exam. I'm gonna check pretty much everything. I'm gonna check your eyes, your ears, check your hair, listen to your lungs, check your heart sounds, check your tummy, check your lower legs. Gonna do some range of motion exercises. Are you pretty comfortable temperature wise?
Yes, ma'am. I'm good.
Okay. If at any time you get uncomfortable, just let me know and we can adjust that. If we start to do any part of the exam and it's uncomfortable for you, like my miracle, we can defer that to a later time if we need to. So you just let me know if anything's uncomfortable for you.
Yes,
Okay. Okay. Good deal. Okay. We're going to start off I'm gonna take a look at your hands, okay? I'm checking your fingers, I'm checking for cap refill. That tells me how well your blood oxygenates your body, and it is brisk and good, okay? Squeeze my fingers. Okay, good hand grip. Do you ever play tennis or anything?
No.
Okay, all right. Okay, I'm gonna do a little range of motion on your hands. I want you to bend your hands up, down, turn them to the side, and back in. Okay, all right, I'm gonna have you do, you can just relax them, just on your legs. I'm gonna have you do some rapid motions. I want you to hit, turn, hit, turn, hit, turn.
Okay.
Okay? Okay, perfect, okay. Good strength, good muscle tone, the skin is dry and intact. Do you have any kind of lesions or open wounds, anything like that?
No, ma'am.
Okay. Do you have any problems with eczema, psoriasis, anything like that?
No, ma'am.
Okay, patient has good muscle tone, good musculature. Okay, all right, good. Okay, I'm gonna warm my hands up a little bit because it's cold. It's 27-degree weather. Okay, next thing I'm gonna have you do is I want you to put your arms up like this. Okay, I'm gonna pull against it, and I want you to stop me from pulling. Okay, and now I want you to push against. Okay, good. Okay, I want you to stretch your arms out for me. Okay, is that uncomfortable at all? Okay, can you turn your hands like this? Okay, good deal, okay. And can you raise them up over your head for me? Okay, perfect, okay, good deal. All right, the next thing I'm gonna do is I'm going to check your reflexes. I'm gonna start up here with your triceps. Just let your arm hang loose. Okay, good reflexes. Okay, I'm gonna turn it this way, move it out of the way of the camera. Okay, all right, and then I'm gonna check your dorsal radius. I'm gonna go up just a little bit. I'm sorry, brachial radius. I said dorsal, brachial. Okay, all right. Again, I'm gonna check your triceps. Okay, good. Okay, and your biceps. Okay, and again your brachial radius. I'm gonna go up here just a little bit. Okay, good deal. Good reflexes. Okay, all right. I want you to put your finger on your nose and then touch my finger. Okay, put it on your nose first and touch my finger. Okay, and go back to your nose. Okay, we're gonna do a sequence and back. Okay, good job. All right, next thing I'm gonna do, I'm gonna check what's called sternogenesis. Okay, in a minute, I'm gonna have you close your eyes and I want you to put your left hand out. I'm gonna put an object in your left hand and I want you to identify it. And then we'll do the same thing in your right hand with a different object. Okay. All right, so go ahead and close your eyes. All right, can I see your left hand? Okay. All right, can you tell me what that object is without opening your eyes?
Oh, paperclip.
Okay, good job. Okay. Can you open for a second? And then close again. Let me see your right hand. Okay, what is that object?
A coin.
Okay, good. Like I said, that is checking for stereogenesis. And you pass with flying colors. All right, next thing I'm gonna do is check your radial pulses. Okay, I'm gonna come in here and I'm gonna check your brachial pulses. I'll push in just a little bit harder to check those brachials. Okay, pulses are 2 plus equal. Good deal. All right, the next thing I'm gonna do is I'm gonna check your head and face, okay? I'm gonna palpate your sinuses, okay? And I'm gonna do that right here. Just kind of feel, does that cause any pressure, any fullness? Okay, all right, then I'm gonna come down here and check your maxillary sinuses. Any pain or pressure there?
Mm-hmm.
Okay, good deal. The next thing I'm gonna do, I wanna look at your hair and your scalp, okay? You have beautiful long hair. Oh my goodness, your hair's long. Okay, I'm just gonna look, I'm looking for any lesions, I'm looking for any, like dandruff, any nits, anything like that. Your hair is clean, it's well distributed, and no issues there at all. Okay. Next thing I want to do is listen to your temporal arteries, okay? That's the arteries that run right here in the temple area, hence the temporal arteries, okay? I'm going to listen with the bell of my stethoscope, and I'm just listening for any abnormal sounds. Okay, sounds good. Okay, all right, good. No bruise, sounds good. Okay. Next thing I'm going to do, I'm going to get a pair of gloves, and I'm going to look at your eyelids, your eyelashes, look at your conjunctiva, which is the white part of the eyes. I have a little fracture in my finger, so it's a little bit hard to get those gloves on, but we can do this. Okay. I'm going to use my white, and I just want to look at your lashes. Okay. Oh, you have beautiful lashes. You have even distribution of top and bottom. Long, beautiful lashes. Okay, awesome. Okay, the next thing I'm going to do, check your eyebrows, and they're well approximated, equal, good hair growth, no loss of hair. Okay, I'm going to look in your underneath your eyelids. I'm going to pull the eyelids down just a little bit. Okay, conjunctiva is white. No issues noted. Okay, no vasculature is intact. No issues noted there. Okay. Next thing I'm going to do is, even though I looked at your sinuses, I'm going to shine a light onto the sinuses. Okay. I'm going to shine a light and see if I can translaminate the sinuses. Okay. I don't see anything opaque or anything there. Okay. The next thing I'm going to do, I'm going to shine the light here on your maxillary sinus, and I want you to open your mouth real wide, and I'm going to look from inside and see if I can translaminate it. Okay. So you got my light. Okay. All right. Open wide. Actually, I'm going to switch to my otoscope because it gives me a little bit brighter light. Yeah. Okay. All right. Open real wide. Okay. All right. This side. Oh, sorry. Okay. Okay. Good deal. Good deal. Okay. All right. Looks good here. And you said no fullness or anything in the sinuses. Okay. All right. Next thing I'm going to do is use my pen light. I'm going to check for what's called the Hirschberg's test. I'm looking for the light reflection in your eyes to be equal. So if you'll look at my shoulder, and I'm going to shine the light directly into your eyes, okay? Okay, and remember that says present and equal, okay? Good deal. While I'm there, I'm going to check your pupils. I'm going to check your pupillary response. I'm seeing if they're equal and reactive. So I'm going to come in from the side and back up. Come in from the side and back up. Okay, perfect. Pupils are equal and reactive. All right, we're going to check for accommodation of your eyes. What I want you to do is follow the tip of my pen. Okay, we're going to go to the right and back. All right, and let's go to the left and back. Okay, good deal. Good deal. The next thing I want to do is check the field of gaze. Actually, I'm going to use my pen light to do that. So if you'll just follow my pen light, we're going to go to the middle, over, up, down, back up, over, a little further, up, and down. Okay, perfect, perfect, okay. And that's checking your cranial nerves 2, 4, and 6, okay? And those are all intact. Next thing I'm going to do is look at your eyes. I'm looking to identify your eye structures. I'm looking at their macula and the retina, okay? And while I'm in there, okay? Is there anything?
No, my nose was just itching.
Okay, all right, while I'm in there, I'm also looking to see, sometimes if people have a chronic disease, which we don't expect in you, but like hypertension, they'll have, abnormalities of the blood vessels, so that's kind of a sign that we look for, but I don't expect that in your case, okay? But I'm gonna come in from the side, and I'm using the eye, and I'm looking at on you, and I do visualize the macula and the retina. Okay, yeah, good deal. Okay. All right, and now we're gonna look at the other one. Okay, I need to calm down. I keep trying to warm them up. Okay. Get a good feel. Okay, there we go. Okay. Macula. Retina. Okay, and I don't see any hemorrhages, no abnormalities in the blood vessels, anything like that. Okay, the next thing I'm gonna do is look at your ears, okay? First thing I'm gonna do is look at the outside of the ear. I'm gonna inspect the ear. I'm gonna tug on it just a little bit. Ear's clear, there's no piercing, there's no signs of infection, no drainage, no lesions at all. Okay, and then I'm gonna look at this one. And this is your tender ear. I do see just a little bit of redness right before the inner canal. I don't see any drainage, there's no ulceration, it just is a little bit red right there. Is it tender when I touch right here?
No.
Okay, okay. All right, again, there's no piercings, the ears are well approximated, and no abnormality noted from the outside. Okay, the next thing I'm gonna do is look in your ears. I'm gonna start with your left ear, since that's the one that's not giving you any problems, okay? I'm gonna come in from the side. Let me know if anything hurts. I'm gonna go in gently, pull the ear back, okay? I see the tympanic membrane, it is pearly gray. There is a cone of light at 7 o'clock and no earwax noted. That's unusual. That's good. Okay, and now we're gonna look at the other one. Okay, and I know this is a little tender. I'm gonna go in real easy. Past that little redness right there. Let me get this where I can actually hold it and see something. Okay, I'm gonna go in easy. Okay. I see the tympanic membrane, it is pearly gray, there's no bulging. I don't see any fluid or drainage. I do see a cone of light at the 5 o'clock position, which is normal to be expected. So that's good, okay? All right, let me take that. Okay, next thing we do, I'm gonna check your hearing, okay? This is called a tuning fork. All right, I'm gonna check it in 3 different positions. The first thing I'm gonna do is I'm gonna strike it. I'm gonna put it right on top of your head.
Okay.
Okay, and when I do that, I want you to tell me which ear you hear better in, or if it's equal. Okay, so I'm gonna strike it, good. I'm gonna go right up here.
That's equal.
It's equal in both ears?
Yes.
Okay, good, okay. All right, the next thing we're gonna do is the RIN test. And I'm gonna, I'm sorry, we just did the RIN. We're gonna do the Weber. Okay, hang on a second. Okay, yeah, sorry. Okay, all right, I'm gonna strike this. I'm gonna put it on the mastoid bone, and I want you to tell me when you do not hear it anymore. Okay. And I'm gonna come just out beside your ear and tell me when you do not hear it anymore. Okay. Okay. All right, and we're gonna do the same thing on this side. Okay, I actually struck a little harder on this side. Okay, tell me when you do not hear it anymore.
I don't hear it.
Don't hear it, okay. And then we're gonna go the other side. You hear it there? Okay. Tell me when you do not hear it anymore.
I don't hear it anymore.
Don't hear it anymore there? Okay. Okay. What we're checking for there is your hearing. When we put it on the bone, we're checking bone conduction, and when we put it beside your ear, we're checking air conduction. And air conduction should be about twice as long as bone conduction, and yours is, so that's good. Have you ever had any problems with your hearing?
No, ma'am.
Okay, good deal. Okay, next thing I'm gonna do, I'm gonna come behind you, and I'm gonna whisper 3 letters, and I want you to tell me what I said, okay?
Okay.
I'm on your left side. 2, 3.
1, 2, 3.
Okay, coming on the right side. 4, 5, 6.
4, 5, 6.
Okay, good job, good job. Okay. Now, the next thing we're gonna do is we're gonna move on to your nose. I wanna check your nose. First thing I'm gonna have you do is place one finger over your nostril and sniff for me. Okay, and now the other side. Okay, no problems. Okay, feel like you're getting good air in? Okay,
Yes.
yeah, it sounds clear. Okay, and then I'm gonna palpate nasal lacrimal gland here, just around the bridge of your nose. Any pain or tenderness there?
No, ma'am.
Okay, all right. And if it's okay, I'm gonna look inside your nose. Okay, we're going to the left side first. Okay, be real gentle here. Okay, you haven't had any nasal drainage or anything?
No, ma'am.
Okay, another side. Okay, I see turbinates on both sides, they're clear. I don't see any no swelling, no growths, anything like that. Next thing I'm gonna do, I'm gonna check your mouth, okay? This gets a little bit more invasive, okay? First thing I'm gonna do is look at your lips. Your lips are just a little bit dry, but with the cold weather, that's to be expected. Have you had any fever blisters, any ulcerations, anything like that?
No, ma'am.
Okay, all right, I'm gonna check your I'm gonna check your facial nerve. Can you smile for me? Okay, frown. Okay, and puff your cheeks out for me. Okay, good. Okay, open your mouth for me. Okay, give my light back. Can't see in the dark. Okay, open real wide. Okay, all right, stick your tongue way out. Okay, say off. Okay, swallow for me.
I guess I'm right.
Yeah, you need to drink water. Okay, alright. Okay, over one. Okay, stick your tongue in. Say off. Okay, utilize the midline. Okay, swallow. That's so hard to do. Yeah, okay. Okay, all right, now I'm gonna look inside your mouth. I'm gonna just kind of peel your lip back here. Let me know if anything hurts. Okay, gums are pink and intact. Open real wide. Okay. Okay, teeth are all intact. I don't see any caries. Your teeth are very straight. Okay, I'm gonna pull your mouth. Okay, stretch your tongue. Just let it lay on the yeah. Okay. Now open real wide. Okay. Check the. All right. Okay. All right. Looks good.
Yeah, I had braces. That's why my teeth are straight.
Oh, okay. Okay, that makes sense. Okay. All right. I want you to push your tongue against your left cheek. Okay, and push against my hand with your tongue. Okay, good strength. Okay, now go to the right. Okay, perfect. Okay, all right, you can let your tongue relax. Okay, I want you to turn your cheek and jaw against my hand, push against my hand. Yeah, okay. Other side. Okay, very good. All right, clench your jaw for me, or your chin. Clench your chin, yeah. Okay, don't let me open it. Okay, good strength there. Okay. Okay. Let's see. Good strength, good symmetry of the face. Everything looks good there. We are going to. I need you to remember 3 words for me. Okay. And I'm going to check these ones later. It checks your short-term memory. Okay, and it's boy, girl, and toy.
Okay.
Okay, can you repeat those for me?
Boy, girl, toy.
Okay. All right, and who was our first president?
George Washington.
Okay, good. Who was our last president?
Joe Biden.
Okay. Okay. All right, I'm going to check range of motion of your neck. Okay. I'm going to have you to pull your head over, like bend your neck. Yeah, okay. Go backwards. Okay, go to the side, left side. Okay, and right side. Okay, very good. Okay. Next thing I'm going to do, I'm going to check your lymph nodes. Okay, it may be a little tender on this right side with the ear thing you got going on, but we'll just see. Okay.
Okay.
All right, we're going to go preauricular. Okay, we're going to go postauricular. Okay, occipital. We're going to go tonsillar. Okay, submandibular. Okay, and submental. Okay, nothing we need there. Okay, we're going to go precervical, postcervical. Okay, and I'm going to kind of go deep chain right there. Okay, and this side. Okay, shrug your shoulders against my hands. Okay, good strength there. Okay, all right. The next thing I'm going to do is check your carotid pulse. We do that one at a time so that we're not including your carotid pulses, because that can cause a stroke. So don't ever do that at home. Okay. Don't try this at home. Okay. Okay. Next thing I'm going to do is listen. Let me turn my light off. Listen to your carotids. I'm going to listen with the bell of my stethoscope. Yeah. I'll come right in here. Okay. And this side. Okay, good. All right, and while I'm here, I'm going to listen to your thyroid, okay? Okay, I'm listening for any harsh sounds, any abnormal sounds. Okay, not hearing it, okay? All right, the next thing I'm going to do is palpate your thyroid, okay? I'm going to feel right here, it sits right below the thyroid cartilage. I'm going to come in, I'm going to feel like this, I'm going to have you turn to the left. Okay, all right, you swallow for me. Okay, good. Okay, turn the other way. All right, and swallow for me. Okay, good. Okay, no abnormalities noted. Okay, do you need another drink of water? Yeah. Okay. Okay. The next thing I look for is your trachea, and it's midline. There's no deviation. Everything looks normal there. Okay. So the next thing I'm going to do, I'm going to come behind you and I'm going to listen to your lungs. Okay. I'm going to start in the back. The first thing I'm going to check for, I'm going to have you lean forward just a little bit, and I'm going to check for chest expansion. So take a good deep breath. Okay. Good deal. Okay. All right. The next thing I want to check for is tactile fremitus. Sorry. Okay. I'm going to put my hands on your shoulders, and then I'll kind of work down your back. And when you feel my hands on your shoulders, I want you to say 99.
99. 99.
Okay. Good. Yeah. It sounds good. There's no blockage, no consolidation noted, nothing that keeps the sound from coming through. Okay. The next thing I'm going to Check 4 is egophony. I'm going to put my stethoscope on your back, and when I do, I want you to say E, okay? All right, so here we go.
E, E,
Hang on just 1 second. Okay, sorry.
E, 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 E.
Okay, good, okay. Yeah, there's, all good, no consolidation. Sometimes you get pneumonia or something like that, it's gonna block that E and you're not gonna hear it as clearly as you, or you may not hear it at all as you do the others. Okay, the next thing I'm gonna do is percuss over your lungs. Again, just checking for that different sound. That would mean there was maybe some fluid collected or something going on there. Come way down. Okay, good. Resonance is clear. Don't hear any kind of signs of any kind of blockage. Okay, the next thing I'm going to do is I'm going to listen to your lung sounds with my stethoscope, and I want you to take some good deep breaths, okay? Ready? Okay, can you raise this arm for me? I want to listen. Okay, do deep breath. Again. Okay, perfect. Okay, other side. Big deep breath. Okay, perfect, sounds good. Okay, I'm gonna come back around. And now I'm gonna observe your chest. I wanna see if there's any thrills, any abnormal movements, any pulsations or anything like that. Take a big deep breath for me.
Sorry.
No, you're good. Okay, good. Respirations are symmetrical, good expansion. Okay, no cough. It looks good. I don't see any pulsations or anything. The next thing I'm going to do is just feel over your chest for any nodules or any tenderness. Do you do self-breast exams?
No, ma'am.
Okay, that's something you need to do on a monthly basis because the key to beating cancer is to recognize it early. Okay, so that's something you really need to do. Okay. Also, if you'll lift this arm, I'm going to palpate your axillary nerves over here. Okay, just making sure.
It tickles a little bit.
Okay. Okay, I'm just checking. Okay. Yeah, but those self-breast exams are very important. Just when you're in a shower, just go in a circular motion. Okay. Okay. The next thing I'm going to do is I've noticed, there's not any pulsations or anything on your chest, but I'm going to go down here to what's called a PMI, the point of maximal input, and that's where I can feel your heart best, and I can actually feel it through the skin, especially with you being a smaller, thinner person. That's really cool because you can't always do that. So it's going to be at the 5th intercostal space, mid-clavicular, and I do feel it right there. Cool. Okay, now I'm going to listen with my stethoscope, and I'm going to listen for a full minute and count your pulse, okay? Okay, heart rate 78. The next thing I'm going to do is listen to your heart sounds. You have 4 valves in your heart, and we can listen and listen to those valves by listening at certain points on your chest, okay? So the first one is your aortic valve. It is at the second intercostal space on the right sternal border. And there it is, okay? The pulmonic is at the second intercostal space on the left sternal border. Herb's point is at the third intercostal space on the left sternal border. Tricuspid, let's see if I can get in here. Sorry. Okay. It's at the third intercostal space of the left sternal border. And then back to the mitral, which is at the fifth intercostal space, mid-clavicular line. Okay, and I'm able to identify all those. I'm going to go back and listen with the bell of my stethoscope, and I'm listening for any murmurs. Okay. All right. So again, aortic, second intercostal space, pulmonic, second, Herb's point. Okay. Tricuspid. Okay, and mitral. Fifth intercostal space. Okay, good. All right. No murmurs heard, no abnormal sounds, no bruits, anything like that. So, okay. The next thing we're going to do is, here a second. Okay. I'm going to have you get up on the table. Okay. We've got a little low pillow right there, made with a quilt, and just take your time and just step up there and stretch out. Okay. And you can go ahead and lie back. Okay. Oh, I'm so sorry. Here, I'm gonna get that out of the way. All right. You okay? You need to scoot down a little bit for the pillow? Okay. All right. Okay. First thing I'm going to do is I'm going to observe your abdomen. Okay. I'm just looking for any pulsations, any abnormal masses, anything like that. And I don't see anything. Can you lean your chin to your chest for me? Okay. There's no grimacing, any pain there, any discomfort? No? Okay. Good. Good. Okay. All right. Next thing we're going to do is I'm going to listen to your abdomen. I'm going to pull your shirt up just a little bit, okay? I'm not going to expose you much here. Okay. Just going to pull your shirt up there, okay? And I'm going to listen for vowel sounds, okay? Okay. Start right here. Okay, good. Your vowel sounds are active. They're active in all four quads. Sometimes they can be a little sluggish and we have to listen a little longer, but yours are actually pretty active. Okay, the next thing I'm going to listen to is your abdominal vasculature. I'm going to listen to your aorta, your iliac branches, and your renal branches and your iliac branches, and then I'm going to listen to your femorals. Okay, all right. Do that with the bell and stethoscope. Okay, now we're going to go down here and listen to the iliac. Go in just a little bit further. Okay. Okay. All right, and then I'm going to listen to good. All right, all pulses are 2+. No worries heard, no abnormalities heard. It all sounds good. Okay. The next thing I'm going to do is percuss over the abdomen. I'm going to start right here. If my hands are cold, just let me know, okay?
Okay.
All right. Can you hear that kind of tympanic sound?
Mm-hmm.
Okay, it's a little bit over there. It's kind of right over the liver, and that's okay. That's to be expected. That's what we're looking for. Okay, good. Okay, all right. Good resonance throughout. Very tympanic, a little bit duller up toward the liver, and that's to be expected. Okay, Holly, the next thing I'm going to do is palpate your abdomen. Okay, I'm going to do a little light palpation, and then I'm going to come back with a little deeper palpation. If anything at all is uncomfortable, then just let me know. Okay. All right, I'm going to start kind of down here. Just kind of going around, feeling that intercostal border. You have a really long thorax. Your rib cage is longer, and that's because of your thin bill, and that's good. That's good. Okay. Any pain or tenderness?
Mm-mm.
Okay, I don't feel any pulsations or anything. Now we're going to go just a little bit deeper. Okay. Ready? All right. Let me know if anything hurts. That rib cage is just right there. Okay, again, I'm just looking, feeling for any kind of masses, anything that we would want to know about. Okay, any of that hurt, tender? Okay. Do your bowels move on a regular basis? Okay, how often do you go? You go once a day, once every 2 days?
About once a day.
About once a day? Okay. All right. The next thing, I was talking to you about your liver. It kind of lies right under that rib cage. I'm going to do a little scratch test to see if we can identify where the border of the liver is. Okay. 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 All right. I'm going to listen right here. Start scratching. Might tickle a little bit. Okay, actually it changes right there, right at the intercostal border. Okay, all right, and I want to see if I can locate the upper border. Okay, so I'm going to pull this up just a little bit. Okay, sounds good. Right there. Which one? Okay, all right, good deal. Okay, next thing we're going to do is sweep the liver, and then I'll also sweep the spleen. Okay, I'm going to put my hand up under your back and warm it up to you. I have cold hands. Okay, I'm going to locate that rib cage. All right, I'm going to go down to there. I'm just going to kind of go. Let's see if I can't help it. There. Okay, good. Okay, all right. We're going to do the same thing over here to the spleen, okay? Okay, ready? Take a deep breath in for me. Okay, let it out. Maybe take that deep breath again when I do the liver. I'm just going to do it one more time. Identify. Okay, big deep breath in. Okay, good. Good. Okay, that we're finished with that part of the exam. You can go ahead and, well, actually, let me do a couple of things first. I was gonna let you sit up, but let me do a couple of things first. I'm gonna go ahead and check your lower extremities. I'm looking for musculature. and you definitely have good musculature. We've already checked your femoral pulses, but we're gonna check those again, just palpate them again. Okay, good. Okay. All right, I'm gonna check your capillary refill of your toes. Okay, good. Okay, it's brisk. Okay, while I'm here, I'm gonna check your pulses right here, your dorsalis pedis pulses. Okay, good. They're both 2+ and strong. Then I'm gonna come in and check your pulses, and they are 2+ and strong. Okay, good. While I'm here, actually I'll come back to that. Okay, all right. I'm gonna have you take your left foot, your ankle. You're gonna put it right here on your knee. Okay, and then you're just gonna slide your foot down. Okay. All right. Can you do that for me? Okay. We're gonna come out this way. Yeah. Okay. Now just slide it down. Okay. All right. Good. Okay. Now this one. I'm getting it. Put it right there. Okay. And just come all the way down. Okay. Good. Okay. I'm gonna have you bend this one up again. Put your ankle right here on your knee.
On my ankle.
Well, the heel of your foot. Sorry. Okay. All right. Then I want to check your hip. Can you let your hip relax there and push down against my hand? Push down. Okay, good. Okay, now push up. Okay, good deal. Good, strong. Okay, we'll set that back. We're going to do the same thing with this one. Just put your heel right there on your knee. Okay, and let your leg relax. Okay, you're going to push down against my hand. Very good. Okay, and push up. Okay, good deal. Okay, while you're here, I'm going to check for, I'm going to do a Homan sign, which checks for any kind of blood clots in your leg, which we don't anticipate on you, but this is how we would check if we were expecting it. Okay, I'm going to push up, and I'm asking if there's any pain in the back of your calf. Any pain there? Okay, let's try this one. Okay, I'm going to bend your knee just a little bit. Yeah, okay. All right, and come up. Okay, good. Okay. All right, this one, bend your knee for me. Okay, just a little bit, stretch it out just a little bit. Okay, there you go. No pain?
No.
Okay, good deal. Okay, the next thing I need you to do, I am gonna have you go ahead and sit up. You can turn around. Okay, all right. I'm gonna pull a chair up here. Have you ever done any running, anything like that?
Yes, ma'am.
Okay, all right, ever had any problems with your knees, any ACL tears or anything like that?
No, ma'am.
Meniscus? Okay, all right. What I'm gonna do right now, I'm checking your ACLs. I'm gonna kind of put your foot between my legs, okay? And I'm gonna check anterior and posterior, okay?
Okay.
You ready? Oh, wait, sorry, my bad. Okay, yeah. All right, we're gonna come up toward, trying to push the tibia up from behind, okay? And there's no give there. Posterior, okay, all right. Let's see what else. Okay, Ansley's. Okay, any pain or tenderness?
No, ma'am.
Okay. Anterior, posterior. Okay. What about that Binsky's? Okay. No flaring. Okay. I'll come up here to this leg. Okay, and again, we're checking for the ACL or ACL. Then the anterior, posterior, anterior. Yeah, okay. Anterior disc. All right, and I'm pushing the tibia up, and there's nothing there. Okay, we're going to do posterior. Okay, one other test I did not do is to check the lateral. So I'm going to do that right now to see if there's any give. Okay, and there's not. Okay, and this is the one that checks the meniscus. Okay, so. Okay. Yeah. Sorry. Okay. All right, and there's no give there. Any pain or anything there? Okay. I would expect it to be. Okay. Babinsky's, no reflex there. Okay. Anterior door test. I'm going to cut my hand here, and I'm going to turn in and out. In and out. Okay. All right. Any pain or tenderness there? Okay. Good. Take your hair tie.
Yes.
Okay. let's see. Anything else? Oh yeah, I'm gonna check your reflexes. Okay, you comfortable? Everything okay? Okay, all right, I'm just gonna let your leg relax, and I'm gonna check. Okay, you have amazing reflexes. Okay, all right. Okay, good. Okay, and I'm gonna come back behind and check the ankle. Okay. And this one. Okay. Let's try it one more time. Okay. Okay. All right. Okay. Next thing I'm going to have you do is stand up. Okay. And I want you to walk. Let me make these shirt that. I want you to walk heel to toe until I tell you to stop.
Doesn't matter which leg first.
No, either one. Yeah, just heel to toe. Okay. And walk back on your heels. Okay. Okay, and on your toes. Okay, good deal. All right. I'm gonna turn you sideways. Okay. I'm looking at your spine. I'm also gonna note that I may not have noticed earlier, but your lateral chest is about half the width of the anterior chest, which is an expected finding. Okay. Your posture's good. I'm going to have you lean over at the hips. Okay, I'm checking your spine. There is normal expected curvature, no scoliosis, no excessive curvature. Okay, stand back up for me. Okay. Very straight, very good posture. No kyphosis, no lordosis noted. Okay, all right. The next thing I'm going to have you do, turn around for me. I'm going to put my hands on your scapula, and I want you to raise your arms out to the side. Just straight out like that. Okay. So just raise your arms out to your side. Okay, and back down. Okay, good. Scapula's even. Okay, good deal. Okay, do you remember the 3 words that I wanted you to remember?
Boy, girl, toy.
Boy, girl, toy. Okay, all right. Okay, Callie, I appreciate you today. We have one last test. Okay, this is called the Romberg's test. I'm going to have you close your eyes and hold your arms out. Okay, just out in front of you. I'm going to straight out in front of you. And I'm going to watch to see if there's any swaying.
Okay.
All right, ready?
Mm-hmm.
Okay. Stretch your arms out. Okay, good. Okay. Romberg's negative. There's no swaying. Okay. All right. Well, Kylie, you did great. I appreciate you coming in today. We're going to get this ear fixed. We'll be prescribing some ear drops. You'll put those in. We'll have you put them in 4 times a day. Okay. No swimming for 3 weeks. Do you shower or bathe at home?
I showered.
You shower at home? Okay, what I want you to do is get a cotton ball filled with Vaseline gauze on it and put that in your right ear when you go to take a shower. The drops should clear it up in just a matter of a couple of days. Before you do the drops, hold it in your hands and warm it up a little bit. That way it's not so cold.
Yes,
If you've got somebody that can put the drops in for you, that's better. Okay, and just lean your head over to the side. Let's see, try here, yeah. Lean your head over to the side, have them put the drops in. Tell them not to touch the tip of the dropper to the ear because that can cause contamination.
Yes,
Okay, and just leave your head over for a few minutes. Or if you're lying down, just lie there for a few minutes. And if you want to, you can put a little cotton ball just loosely, not pushed in, but just loosely. Okay.
Yes,
If it's not better in a week, or if you start running fever, or if you start having a lot of drainage, any colored drainage, anything like that, start having more pain, any other symptoms associated with it when you come back in.
yes,
Okay. All right. Any questions about anything?
No.
Okay. Well, thank you so much. Hope you get to feel it there.
Yes, thank you.